Okay, so we are here today. Instead of having including this presentation with the regular general membership meeting, which will be next week, we thought it'd be best to give Mount Sinai their own block of time to do a presentation on COVID vaccines. And because there's been a lot of controversy, a lot of uproar, positive, negative on this whole COVID and the testing. And I thought it'd be a good idea, especially what's going on with the city and these mandates, which we got a restraining order, temporary restraining order on some regarding the mayor's mandates. But that we'll get more into that next week with Harry and the lawyers. But today I wanted to give them a platform to talk to the membership and retirees, anybody else who's interested about COVID. So I'm going to turn it over to Ms. Lugo right away because it's not going to be a long meeting, and this will be posted. Thank you.
Thank you, Globina, and thank you to all the members for allowing us to be here. Can you all see my screen?
Yes.
You're able to see my screen? Okay, perfect. So I apologize. I have two screens. So I apologize if I'm kind of turning this way. So I apologize for that. So we're gonna be here talking about COVID long haulers, long-term effects of the COVID-19. Joining me is also Dr. Yelena Globina, who will be discussing furthermore in detail the information that we're all here to hear. So this is just a disclaimer. With COVID-19, there's so many constant changes with the vaccine and the updates and the mandates and everything else. So this is just a disclaimer, just letting you know that the changes that take place, we try to follow as best as we can with all the changes that are taking place. So just a little bit about the Selikoff Centers for Occupational Health. We are housed in Mount Sinai Hospital. We provide services to workers who get injured on the job or have occupational exposure. And our overall goal is to keep workers healthy and their workplaces safe. And as stated, we work alongside and we help employers, unions, and the community-based organizations to develop a return to work plan, in regards to the coronavirus exposure and setting up programs to protect workers. As you can see, we do have several clinics. We have one in Staten Island, where actually Dr. Globina is the medical director for our Staten Island clinic. We have our main campus, Manhattan, Yonkers, and in Suffolk. So I'll go a little bit more in detail about the services that we do provide. We have confidential medical examinations of diagnosis and treatment for work-related medical conditions, as stated. COVID-19 is one. We coordinate specialty medical cares. We provide screening for exposures. Our overall goal is disease prevention. We want to make sure that workers are healthy and they're safe. We have a multidisciplinary team of ergonomists, industrial hygienists, we have social workers, we have workers' compensation coordinators that work alongside together to make sure that workers are provided the best information as possible. We are also part of the World Trade Center Health Program, and I believe we provided that workshop to you all before, so we thank you for that. So with COVID-19, the medical support that the Selikoff centers provide is there are basically three different types of clinical evaluations that we do. The first one is the medical screening. We evaluate whether a worker did get exposure to COVID-19 at work. There are ways, depending on what the story is of each employee. Every case is very different, so we really can't kind of pinpoint one or another. We also provide workers' comp management. So that alongside with our workers' comp coordinators, we'll coordinate with our medical providers all the necessary paperwork that is needed. The second thing that we do provide is the COVID-19 status assessment. So we assess whether an employee can return to work after recovering from COVID-19. So these are things that change, and we really go along with the CDC recommendations. So every case is very different. And again, like we stated, we can't pinpoint one from another. The third is the functional capacity assessment. So it details the reasonable accommodations recommendations for workers depending on specific health concerns. So that's the third clinical evaluation that is done. So as mentioned, we do have 4 clinical centers, clinics that are provided for our workers. This is our website, and this is our actual call center number. I will put it in the chat as well. So if you have any questions, you just kind of want to just get information, want to make sure to find out more, please feel free to call our call center. They will work alongside you and provide you as much information as possible. And lastly, on my part, we highly recommend that you download our mobile app. The mobile app provides you so much detailed information, especially, you know, my favorite part of it is your specific job, what you do, and it will detail what kind of exposures, what injuries you can get, and how to prevent that. So the app is so useful, and it's consistently changing. So if there's something that you see there that you wish we should add, please let us know, because we're consistently changing it. We always ask all the employees, unions, to give us as much information as possible, because we will make sure that we will add that there. This app is specifically for you, and we work alongside you to make sure that that information is there. So a little bit about the COVID data. So this is the COVID data. And in New York State, where we have confirmed COVID cases of 2 million, a little bit over 2 million, with deaths of over 54,717, just in New York State. Total doses of, which include first doses, is 25,139,710. And fully vaccinated is 12,055,332. So basically the percentage of population fully vaccinated in New York State is 61.59%. Now, if we look at the USA, so that's all of the United States, confirmed COVID cases are 41,627,946. And deaths are 666,607. The same thing with the first dose vaccinations is over 3 million, almost getting to 4 million. And fully vaccinated is 180.1 million. Now, the percentage of population fully vaccinated is 54.9. So we wanted to give you that information before Dr. Globina begins to talk a little bit more about the vaccine and just COVID itself. And so we're going to kind of lead this on with just the numbers. So Dr. Globina, you know, we want to welcome you and thank you so much for taking the time to speak to the United Probation Officers members.
Thank you so much. It's such a pleasure, and thank you very much for this opportunity to present current findings and hopefully some compelling information, dispel some myths about long COVID, about COVID vaccines, and along with this presentation and all the different things each and every one of us does help end the pandemic and return to normal. So the numbers are very compelling. They're unfortunately growing, and they will continue to do so. And so it's important to discuss what are we going to what do we have to look forward to? Unfortunately, there are a significant number of people who get sick with COVID and develop long COVID symptoms. And the only way so far that is known to us to prevent it is through vaccination. And so we'll focus today on describing what long COVID is, how it impacts our bodies and our ability to work, what are potential treatments, and also how do we prevent it. So I'll go into some detail about vaccination against COVID, and hopefully we'll have some time for questions. Next slide. So long COVID is still in the midst of being defined because it is a new condition, but the general consensus is that post-COVID conditions, the cutoff in time is about 4 weeks after your acute infection. And then long COVID, it appears that the consensus is for individuals who have persisting or new symptoms since the acute infection has also resolved, ongoing for 12 weeks or longer. Next slide. So who gets long COVID? There are two distinct groups of individuals who develop long COVID. One is those who had severe COVID. So people who were on a ventilator in the intensive care unit, almost half of them develop what is called a post-intensive care syndrome. And that leads to quite significant disability that is really all encompassing. It is physical from deconditioning, from having suffered the severe disease, cognitive, meaning that there could be effects on the actual brain, or just psychological disability, or a combination of both leading to cognitive disability. And so it is really, really debilitating and all-encompassing. And then there's another group of individuals who had outpatient or mild to moderate COVID, and probably didn't need to go to the emergency room or weren't hospitalized. And it is among those that certain individuals, it appears to be, are at a slightly greater risk of developing long COVID. And we will learn more as we go along. But it appears that middle-aged adults, especially women, especially those of increasing age within that group, who had an infection that had many different symptoms. So not just a headache, but a headache and a loss of taste and smell and body aches and perhaps some nausea and vomiting, or maybe diarrhea. So different body organs were affected. Or those who had before acute COVID, chronic medical conditions. So individuals who were already predisposed and already had health problems. So how does long COVID manifest? So first of all, it manifests differently for different individuals, but this is a list of the most commonly presented symptoms. And if you look at the picture, actually, it'll probably give you a better idea of the fact that it really can affect any part of your body. And I will go through each individual symptom and how that affects our ability to return to work next. So fatigue has been cited as the most common lingering issue after acute COVID has resolved, meaning that your fever is gone, you're supposedly have recovered, you no longer have to isolate, and yet you don't feel like you're back to baseline. And fatigue can manifest and can present in different ways. You can have just fatigue that is constantly there. You can have fatigue that comes and goes. It can be triggered by different degrees of activity, whether it's physical or mental. And it can also be just a reduced overall ability, overall level of activity. And of course, any of the above can delay one individual's ability to resume work quite significantly and introduce significant delays with being able to go back and function at full capacity. Next slide. And then, of course, as you can imagine, this being a respiratory virus, shortness of breath, cough, decreased exercise capacity are also common lingering symptoms. And they can have some really significant impact on somebody's ability to go back to work. So if you're working in an environment that is dusty or has fumes, allergens, or there's smoke, shortness of breath can be triggered and aggravated by it. If you have to wear respiratory protection, such as a respirator, you may not be able to qualify for respirator clearance. If you have a cough that is persistent or episodic coughing fits, you may have trouble with prolonged verbal communication. So for example, if you're a teacher and you have to give a lecture, you will have a lot of difficulties if you go into a coughing fit. Same for public-facing jobs. The heart has been commonly affected by COVID as well. And so individuals with long COVID often complain of palpitations or that feeling like their heart is about to jump out of their chest, rapid heartbeat. When they get up from a sitting or a lying down position, they get very dizzy. They can't stand for too long. They get dizzy, their heartbeat goes up again. Some people have chest pains. And how does that impact somebody's ability to return to work? Of course, exertion is a major limitation in someone who has heart disease. So if you're a construction worker working in heavy machinery, if you have to work at extremes of temperature, you can't go back. You really will not be able to perform your essential job functions. And of course, we cannot forget the neurological and the mental health consequences. We talked about fatigue, and that is complicated by headaches, brain fog, memory loss, difficulty concentrating, and mental health problems such as depression, anxiety, and for some individuals, PTSD. So if you think about jobs that require attention or concentration, or jobs that require recall, safety sensitive work, all of this can be really greatly impacted. So one example could be if you have a nurse going back and she has to give out medications. That is just not possible if you have memory loss, if you develop brain fog and you can't concentrate. And that's just one example. So what do we have to offer at this time to individuals who have long COVID and they're still suffering with it? What we have learned is that because long COVID and COVID, acute COVID, can affect various parts of the body, you really need a multidisciplinary team approach to this problem, to this medical problem. So you need involvement of various medical specialists. So be it a cardiologist or a lung doctor or ear, nose, and throat doctor. You have to have a rehabilitation medicine specialist who can help you regain function. Internal medicine is very important. No less important is an excellent physical therapist who can understand this condition, occupational therapist who can help return to work. You have to offer support in returning to work. So it could be job simulation to guide restrictions, functional capacity evaluations to help from the medical standpoint, and ergonomic assessments. And of course, we cannot overlook the mental health. The need for support is really overwhelming what is available, unfortunately. That had pre-existed and has been that much more exacerbated during the pandemic. So you have to have a psychiatrist, a therapist, a social worker, a workers' compensation navigator. So all of these really key elements to help create a wholesome and a successful treatment program to bring patients who have long COVID, hopefully back to their pre-COVID function. And so how do we prevent it? As I previously alluded to it, there's only one way to prevent long COVID as far as we know today, and that is to get vaccinated against COVID-19. And so I'll switch gears a little bit and I will talk about vaccination. So the initial slide, next slide, please. I'll take just a minute to show, yep. this cartoon that talks about how vaccines work. So essentially, we introduce a harmless type of a form of a germ, a part of a germ into the body. And the body thinks that it's infected. So it's attacking that part of the germ that's not actually making you ill. The immune system forms a memory, remembers this germ or microorganism, so that when you're exposed to it again, it already has the weapons, if you will, to attack it and prevent you from getting sick, or prevent the sickness from being very severe. And there are many different types of vaccines, and some vaccines require more than one dose. And you probably, those of us who have kids or are familiar with childhood vaccination, some kids you give year after year. Some vaccines you may have had as a child, you've had to get again as an adult, right? So an idea of more than one dose is not new to us. And why does that happen is because sometimes to reach optimal immunity, you need more than one dose. Sometimes there's seasonal variation. And sometimes childhood vaccination immunity we had as kids wears off over the years, and we need a boost as an adult. And why do we vaccinate? Well, just like any medication over the counter or prescription, vaccines will have side effects, but most of the side effects are mild, which is very good. But most importantly, vaccines prevent diseases that can be serious or even deadly. And so I'll focus a little bit, and this is a busy slide, but I wanted to spend a minute to talk about what kind of vaccines are available to us now. So there are two types of vaccines: adenovirus vaccine, that's the Johnson & Johnson you've heard of. It's a one-dose shot. And then there are messenger RNA or mRNA vaccines. That's the Pfizer BioNTech and Moderna vaccines. Pfizer BioNTech has been approved now for children 12 years and older. So that's very good news for us. The booster has already been approved for immunocompromised individuals. And we're still waiting to hear about booster for the general population. So you may have many different questions about these vaccines, because to all of us, it's new for all the obvious reasons. But really, the technology has been in the works for much longer than you can imagine. So, you may say, well, would these vaccines develop too quickly? Not entirely. Part of the reason we were able to develop these vaccines with at such efficiency is because we had the entire world, the scientists from the entire world, focusing on ending the pandemic, right? This is a global pandemic. And so really all hands on deck to the full extent of the meaning of this phrase. mRNA vaccine technology has been researched and developed in 2005. So it has been researched for many, many years before that even. And then Johnson & Johnson, the adenovirus vaccine technology, was developed in the 1970s. So neither of those are new. And of course, it's very, very important to monitor for vaccine side effects from the observational studies at this point, not the clinical trials that were conducted during vaccine development, but now that the vaccine has been administered to almost 400 million, almost 400 million doses have been administered, you really have to keep an eye out for what is happening when you give this shot to such a large number of people. And so in an unprecedented manner, really, we have never had such intense data collection when it comes to vaccine side effects and vaccine safety. So there are 4 different ways we can report vaccine side effects. And so far, what we have learned is that there are very few serious side effects, and they're exceedingly rare. And of course, everyone is happy about that. So the first one would be a severe allergic reaction called anaphylaxis. You've probably heard about it. And that happens on average approximately 2 to 5 people out of 1 million people who are getting vaccinated. So a very small number of people. You may have heard of a problem where people form blood clots and low platelets. It's called thrombosis with thrombocytopenia syndrome, TTS, as a result that has been linked to Johnson & Johnson vaccine. And so far, the FDA and the CDC have confirmed 46 cases out of over 14.5 million doses. So again, 46 out of 14.5 million doses. So very, very, very rare. Having said that, that is an important consideration for women who are 50 or younger. So when you're choosing which vaccine to get, thankfully we have ability to choose. You can speak with your doctor to see what would be the best vaccine for you. And the only vaccine-related mortality events from COVID-19 vaccination were actually tied to that TTS, that syndrome that I mentioned. And you also may have heard of inflammation of the heart and the lining of the heart, myocarditis and pericarditis that have been associated with the mRNA vaccines. And so far, there have been 854 confirmed cases of myocarditis and pericarditis. Most of these have been seen in either young men or adolescent males. So if you're in that demographic, then that's something for you to think about. That's one of the nuances. Again, exceedingly rare. And so what are the common side effects? So common side effects resolve on their own within 24 to 36 hours. And these are usually a headache, fever, body aches. Sometimes you have diarrhea, sometimes nausea, vomiting, and fatigue. Now, here's a red flag. What is not an expected side effect of vaccination? So if you develop new onset of shortness of breath, new cough, new loss of taste and smell, that is not a side effect of vaccine. You're possibly sick, possibly with COVID. Get tested, call your doctor. So you probably keep asking, why should I get vaccinated if you haven't gotten vaccinated yet? And really the take-home message is vaccines are still incredibly effective at preventing hospitalization and death. They prevent the spread of COVID-19 and help us end the pandemic. They prevent long COVID. And vaccination may be, and this is still, we still are gathering data about that, but they may be more effective in forming long-lasting immunity than past infection. Hard to say. Still, the data are still out there. And what about the variants? So there are a few variants that we have been observing, actually more than a few, I should say. SARS-CoV-2, the virus will naturally change over time. So this is expected. And the major health organizations such as the WHO, the CDC, all watching the different variants. And the World Health Organization ranks them depending on their severity and how dangerous they are, right? So you probably see a list of different variants that are now being watched in the world. In the United States, we're now seeing alpha, beta, gamma, and delta, delta being the predominant variant right now. These also happen to be called variants of concern. So these are the dangerous guys. And in New York State, as of now, really over the summer, the major change took place. Delta variant is the most prevalent still. And this will probably change as it has been changing all along. And so why do we worry about variants? Well, because they can affect how quickly the disease spreads, how severe the disease, how it changes, how severe it becomes, how difficult is it to get the diagnosis? You know, is it the testing that we're using now still accurate for the new variants? How effective are the vaccines against the new variants? And is the treatment that we have developed for the older variants still effective for the newer ones? So lots to think about, lots to consider. So far, so good. Okay. Delta variant may be more severe. And I want to say that the FDA authorized and approved vaccines, continue to be quite effective at reducing risk of hospitalization and death with all of the variants that are circulating right now. So another question that often comes up is whether or not vaccine affects fertility. So far, there's no evidence that the vaccines affect either sperm count or motility of the sperm. And there's no evidence so far of the vaccines affecting women's fertility. And what about individuals who have allergies? You heard me mention anaphylaxis, a very serious type of allergy. So far what we know is that if you have good old pollen allergies, hay fever, or if you have food or animal allergies, you're fine to get the vaccine. If you have prior allergic reaction to vaccination, or if you have allergies to medications, then it's always wise to speak with your doctor before you get the vaccine. And if your doctor says it's okay for you to get vaccinated, out of overabundance of caution and prudency, please get the vaccine at a hospital where you can get help if needed. And what about heart inflammation that I had mentioned? This is one of the serious side effects, okay? It has been reported with the mRNA vaccines, very rare overall. And if you have children or you're concerned about adolescent boys or young men, it's a good idea to speak with their pediatrician to get some advice. And so what is the bottom line? The vaccines are still extremely effective against hospitalizations and death. They're equally effective across all demographics. And the safety profile has remained favorable and consistent with what has been reported in the clinical trials. And we'll continue to learn more. And so if you need help finding a location to get vaccinated, you can always reach out to us, but here's the list. And we're happy to answer your questions.
Thank you so much for the presentation. We do have some questions in the chat.
Great.
You see it? Could you see them? Who's going to read these questions? Charlie, read the question. Okay. So the first question is to Dr. Globina. Can you discuss vaccine-related heart inflammation? I think you did that already, right?
Yes, we did.
Is Johnson & Johnson on pause?
No.
Okay.
No longer on pause.
It was, all right. Do you get antibodies from the vaccine?
Could you repeat the question?
Do you get antibodies from the vaccine?
I don't think I understand the question. Is it acid?
I don't know. Joanne, can you clarify that question? Jump in, because I don't know what that. Ms. Palmer?
My question is, after you receive the vaccination, do you develop any antibodies against variants?
Got it. Oh, that's a great question. So you develop antibodies against what's called the S protein, right? The spike protein. And that has been consistently still quite effective against hospitalization and severe disease. You can still get mild COVID, but hospitalization and severe disease has been mostly seen with the new variants among the unvaccinated, thankfully.
Okay. Another question is, let me see. Vaccine. Hi, Miss Hunter. Okay, hi, James. Okay, not that one. What about if you are pregnant and have an underlying condition and get COVID? Can you still get vaccinated? And can you get vaccinated, period, if you, does it affect the baby? That's the second part. I added that in. You can.
So two parts to this question, actually more than two parts. The first one is, there are certain nuances to timing a vaccination and the type of vaccination, and some of them I alluded to in terms of being 50 or younger female, being an adolescent boy. The best advice I can give is sit down with your primary care doctor, sit down with your OBGYN, and speak about this in detail as it pertains to your specific case. So hopefully that helps. But overall, we do recommend vaccination in pregnant women because the vaccine has been safe in pregnancy, but having COVID has led to miscarriages.
Oh, wow. Okay. Next question. What vaccine is the most effective?
They're all about equally effective. And we may end up seeing changes depending on the variants.
Okay, and the last question, and the rest of them, I think we get, two more. Has Pfizer vaccine, commonality vaccine, Danny Moore, what's the question? Has the Pfizer vaccine commonality?
Has the Pfizer vaccine commonality been approved yet?
I don't think I understood the question.
Say it again, Danny.
The Pfizer vaccine Comirnaty, Comirnaty. I'm just wondering if that has been approved yet and is it made available?
What is that? Is that something new?
Yeah, it's a vaccine that Pfizer came out with.
So the Pfizer vaccine has been FDA approved,
Right.
and it is approved for children 12 and older.
But have you heard about the one called Comirnaty, the one I just that I put in the chat? Comirnaty.
So I will look into it and get back to you.
I'd appreciate that. Thank you. Yeah, because I was told about it that it's been approved. It was approved by the FDA, but it wasn't made available yet. It hasn't, it wasn't manufactured yet.
Okay. And there's a survey. I'm gonna ask one more question, and I know we have to speak on short on time. There's a survey in the link that they would like for you guys to respond to get a feel of how I guess more about the training, right? And the other question I want to ask you: can a doctor tell a person? Because I've heard this, and I don't know how true it is. Can a doctor tell a person not to get a vaccine? They suggest they don't get a vaccine because of their health condition. Does that make sense? Or is that a myth?
So there are exceedingly rare circumstances where the vaccine is contraindicated. In fact, even if you have anaphylaxis, the severe allergic reaction to vaccination or to other, whatever it may be that you'd be allergic to, Mount Sinai actually has developed a special protocol for these individuals and has given out hundreds of COVID shots for individuals with history of anaphylaxis. So what's more likely is that, let's say somebody is acutely ill with COVID or another condition, then they have to wait, until they have recovered and then they can get vaccinated. Or let's say they had another nuanced situation and the vaccine may have to be delayed. But otherwise, extremely few situations where it's contraindication.
And the final question is, our attorney, Jordan Zingler, is still working with you, Maria, on these COVID-related cases. So just a reminder, Maria, you'll share the link with us so we can share this. All right, so we're gonna share this, have it posted on Sandra will post it on the website. It'll be posted. And also a reminder, we have our workman's comp attorney, Jordan Zingler, who works closely with Mount Sinai on these cases. So if any of you, not revealing your business, have had COVID-related symptoms or been sick with COVID, because the doctor mentioned about they can kind of tell with it. I don't know the story, but I suggest that you connect with Jordan. We'll put his information up again on the website for you to have. Maybe we'll have him come again and talk to you about it. But we definitely have his phone number available, so you can call the union office or you can call me. Okay, if that's it, any other questions, send them to the United Probation. What's the website, Charlene and Tangi? I forgot. United Probation. What is it? United Probation. Somebody jump in. United Probation. Anyway, we have rules.
at gmail.com.
Thank you.
@gmail.com.
My
Yeah.
brain, I got brain. You're not at gmail.com. Send us the questions and then we'll forward them to the doctor and Maria, all right? So I want to thank you all, ladies. I know you got to run. Want to close it up, Maria? Anything?
No, I just,
310 evacuees expected to
Cut the
arrive.
TV on.
Governor Lamont says Connecticut's Department of Social
Block them. Thank you. Go ahead, Marie.
so I just, I'm not on mute. Okay, I just wanted to thank you, Dalvina. It's always a pleasure to work with you and your members. And again, as stated, if anyone has any questions, I posted our call center number. They're able to walk you through, answer any of your questions. If you were diagnosed with COVID and you believe you had COVID at work, please feel free to contact us. You will be able to see one of our providers, and they may be able to assess whether you you can file workers' comp for your COVID case. Again, it's always a pleasure, and I added also the email to our clinic, so you can email directly to the clinic. Someone will contact you directly. And Dalvina, again, thank you so much for always allowing us to speak to you and your members, and we're here to help in any way.
We appreciate you. We are so glad we have a relationship with you guys. We need this. We need every aspect covered for us. Thank you so much. And you have a good night, ladies.
Thank you very much. Take care.
Okay, take care.
Bye-bye.
Bye-bye.
So,
Bye-bye.
bye-bye. I want to thank, don't get off yet, real quick. This
Oh.
meeting- Stop it. Cut the TV down, Vera. Cut it down. Tangent, thank you. Yeah. Next week. Yes, Charlene.
Are they off? Are the doctors off?
Yeah, they are.
I'm a little concerned that she didn't know about the COVID vaccine that was approved.
She said she's going to look into it.
Yeah.
All right. So the next week.
Yeah, that was my question. Yeah, exactly.
She said that the
That just
Pfizer.
shows you that how often these things are changing. That's science.
Because it was approved. They named it. That's what they named
I
it.
don't
and it
think
was
she
approved.
knows it that name.
Yeah.
Anyway, she'll get back.
Charlene, you heard about it, right?
I did. I sent you
I
a
never
message.
heard about
I was
that.
a little taken back by the response because it was
Right.
approved for 16 and over.
Yep, exactly. That's the
That
information
particular
I
one?
got. That's why I
particular one?
asked her.
It's for 12 and up, between 12 and 15, it's still approved for emergency use. And then for 16 and up, it's been approved and they named that Comrarity or whatever.
I never heard of it.
Yeah. It's I heard, that one, the one that was approved for emergency use is the biotech.
Oh,
And the
correct.
one that-
Can I
and
share a
the one-
screen?
Right, and the one that they approved by the FDA that's not covered for liability for the pharmaceutical is the Comirnaty, and a lot of people don't know about that.
Yeah.
That's why I asked her, was that yet made available?
I don't know. Those are good questions though, and hopefully she'll be able to get back by the time we.
Yeah.
Danny, that was a good question. It's good to know you're paying attention.
It's a good thing you're doing your science homework. I hope you did that when you was in high school too.
Yeah, I read a lot. Yeah,
You're a reader. But listen,
I read everything. Yeah.
that's good, and it's a good, and the reason I had this, I thought this meeting was important because of like I said, some of you guys, ladies and gentlemen, wasn't at the beginning of the meeting because I thought it was necessary. For us to try to get as much information as possible for those of us who are apprehensive about getting the vaccine, for those of us who need to know more about the disease or the virus itself, for whatever reasons we need to know, because there's a lot of and look at that. This Danny and Charlene was talking about something that I didn't even know nothing about.
Well, I think everyone's hesitant because they're nervous of the long-term effects of the vaccine
Right.
and what the vaccine could do to your body long-term.
Right.
So I think there should be a discussion of the safety of the vaccine as opposed to the virus. I think at this point, we all have so much education on the virus. Now we want to know.
Did she touch upon the vaccine and the side effects? She did touch.
Yeah, but you notice, I noticed doctors too, they're very like, they dance around the whole safety issue of it. Because they really don't know.
If I may,
because
they
I-
want you to
first of
take the
all-
vaccine.
first of
They
all,
won't
the
talk about
vaccine-
what could be wrong.
Right. First of all this is still very new,
Mhm.
and you can't really say the results of anything until studies are done later on. Because if I just got the vaccine earlier this year, I don't think too many people can really say for sure. It's called
Mhm.
science, and science changes all the time. Like I said, this was about individuals' choices wanting to go get the vaccine for whatever reasons not to want. It's just for informational reasons. We're none of us on this COVID, on this Zoom are scientists. This was information. I'm not here to challenge. None of us is here to challenge science. None of us is here to challenge the doctors. Okay, we know what we know as probation officers. Laws, things, fix your eyes, speak. Things change all the time. Okay, we're just here for information, right? And that's what this is here for. So going forward, next week we're having another meeting, another general membership meeting. This meeting, Eric Adams is coming back to talk to the members and the retirees and the active. So if everybody, it's very important that you be on time. He's going to come on at 4:30. He's going to be with us for about a half hour, from 4:30 to 5 o'clock. And then after that, for the retirees, you had some questions about the about the Medicaid.
Oh, yes.
About the Medicare Advantage. Now we had
Yes.
Harry did a preliminary on July 28th, and Tanja posted it. So if you want to get an idea of what he talked about from the last time, because it was a retiree only meeting, that information is on the website.
That's a hot topic.
It's a hot
Yeah,
topic.
but they also are sending out information. I just picked up my package. They explained to people that are currently on Medicare or potential candidates that are reaching the age of 65. They're sending out literature on that, and that's
So what I'm not going to do is
I didn't get mine
no,
yet.
no, but I'm saying
it's on the way. I just got mine.
all right. So listen. This meeting, I'm just giving you an overview of the agenda for next week.
Got you.
I can't speak to the Medicare Advantage. I don't know nothing too much about it. We're gonna have Harry come next week. He's gonna reiterate or confirm some things that got in place since that last meeting, but I just wanted to give a FYI on July 28th. I believe there was one already, a presentation already done. And so, like I said, you can get on at 4:30 next week. You'll have the mayoral candidate, Eric Adams, who's coming back to us the second time, which is a good thing, right? To talk to us about his vision and for us and about us and his relationship with us. Next Wednesday, Senator Andrew Gennardez will be touring Brooklyn adult and family services in Brooklyn next week from 12 to 2. So with that said, I'm gonna greet you all adieu and have a good night.